Yes.
Yeah.
Great. Okay. Well, welcome, Beata. Now we are recording this session and we are going to be placing it up on YouTube on our PAVE website. So over to you, and thank you very much for your...
I am terribly sorry, but there is this working? Yes, it is. Okay, sorry. Yes, all good. All good. Thank you very much. Okay, so let me start. So the talk, we're going to talk about HPV and its connections to cancer, unfortunately. So we're going to discuss why is this an important topic? Why is a dentist talking about sex? And what is HPV? What is the virus actually? What malignancies it causes? And in particular, because I'm a dentist, we're talking about oropharyngeal, which shortly is throat cancer, and pathophysiology. And I will briefly introduce the study that we've conducted at the University of Sydney regarding the prevalence in Australian population. So why HPV is important? I'm sure you all are familiar with HPV. You hear all too often about the cancer of the cervix, which is connected to HPV. And of course, we hear all too often about tragic stories of young girls, like the one here in this article, that suffer from cancer of the cervix, very often not diagnosed in time, and therefore very often fatal, unfortunately.
Wow.
And I'll introduce you to the star of my talks, Michael Douglas, who on national television announced that his throat cancer is caused by oral sex, which of course caused a bit of a stir up. But this is actually true. The HPV is transmitted via sexual way and through various sexual behaviors. And when we talk about oropharyngeal cancer, it's oral sex. And even though it is shocking, this is actually what is happening. And Michael Douglas, the star of my talks, announced this on a television, national television, which was a bit of a shock to his wife, I bet.
Yeah.
So in the United States, they have run a study, and they found that there are two types of throat cancer, oropharyngeal cancer, which is the cancer caused by alcohol and smoking, and the HPV virus caused. So while the prevalence of cancer caused by tobacco and alcohol dropped in recent years, the prevalence of cancer caused by HPV has increased dramatically, 250%.
Wow.
Which is a dramatic increase. So why is the dentist talking about sex? So this is a bit about me. I am a dentist, a practicing dentist in Sydney suburbs, and well, there was a moment that patients started to inquire, oh, can we get HIV through AIDS, through kissing? And I thought, oh my goodness, I'm not sure, I don't know what to say. Anyway, decided to do something about it. At the same time, there was a talk about HPV, and I thought, why don't I do something about it? So I joined a university back again. I'm a University of Sydney double alumni now. So joined again and did masters in HIV, STIs, and sexual health, and with major interest in HPV. Through this journey, of course, it was a wonderful journey, very interesting course, and I made a lot of friends. And the picture here shows me in Cambodia, because one of the students doing the course was sponsored by University of Sydney partially, and this was a doctor from Cambodia. Cambodia has a lot of HIV cases, and yes, so they're managing all right. There is a lot of education about it, a lot of stigma though, so people don't receive the treatment the way they should. But anyway, all in all, I ended up going to Cambodia and treated some little patients, Cambodian children from a local village around the center where I was. Yeah, there was a wonderful adventure, I'd say. So this is me with a friend of mine who also volunteered to assist and treating poor children in Cambodia in one of the cultural centers. They used to be called orphanages, but and they were run by foreign organizations. But because of notorious sexual abuse of children there, the Cambodian government said, no, thank you very much. We don't need this type of help. So they've changed into cultural centers. So that's called cultural center now. Very well working, providing a lot of information and education for children, providing them with means to support themselves in life. So an excellent idea. And this particular organization, run by Australian organization called Hope for Cambodian Children, was never accused of any problems, and I think really full of admiration for director Peter, who is doing such a wonderful work. Anyway, so this is a picture of us in Cambodia, and this eventuated after I joined. I mean, this happened after I joined the university course. This is just to show you how one little step, a course, university can well lead you in different directions.
Yeah. Wow.
So what is HPV? HPV is a small virus. It's non-enveloped. It's a really tiny virus. This is why often it can even penetrate latex. Yeah, they very fine and very contagious viruses. So there is still little known about the epidemiology of infection. However, again, the American Health and Nutrition Examination Studies found that the overall prevalence of HPV in American population, grown-ups, well, 14 to 69 years of age, was almost 7%. With high-risk HPV, around 3.7%, and low risk 3.1%, because this virus can be divided into high risk, causing cancer, and low risk, causing lesions like warts, just ordinary warts, for instance.
Wow.
So, so there are different subtypes of HPV. So it's like pretend it has over 150 brothers and sisters. This particular virus. Some of those subtypes are benign, and some can cause, unfortunately, cancer. So type 16, isolated from the cancer of the cervix, has been declared the main responsible carcinogen, but now we know that there are more. There is 16, there is 18, and there is a lot more subtypes that are responsible for cancer formation. And from this, there is sufficient evidence now that the same subtype, 16, but 18 and others, are responsible for cancer in oropharynx, which means throat. So oropharynx refers in short to the area behind your tongue. This is the back wall, the back wall of sort of when you open your mouth, so there's a wall, so this is part of it. The back of the tongue, uvula, soft palate, and tonsils. This is the area where cancer of oropharynx can present.
Wow.
So like I mentioned, there are over 150 types of HPV in 2 groups. As you can see, there is 16, 18, 31, 33, and all, and even now probably more and more, because every day probably we discover more and more variants that are carcinogenic. Perhaps not every day, but maybe, well, every year. And types 16 and 18 are responsible for around 70% of cancers of the cervix. Whereas the low-risk subtypes, which are majority, with type 6 and 11 being linked to 90% of genital warts, but they benign warts. Wow. There are cancers that are associated with HPV. Of course, cancer of the cervix, which, as you can see, quite prevalent, however, with tendency to dropping in numbers now, because thanks to vaccination programs, anal cancer, penile cancer, head and neck, as you can see, quite numbers there as well in prevalence, incidence. And vulvar and vaginal cancers as well are connected to HPV. So it's not an innocent guy, this one. Patients who are being treated for HIV are more susceptible to infections, to other viral infections, HPV included, of course. And as you can see, HIV and HPV are not a very healthy mix in terms of cancer, because there is quite a number of cases, as you can see here with the highlighted area. Yeah, so this is one of the problems for HIV patients, that they are prone to viral infections, and HPV included. Fortunately, we have vaccines now, and we have a vaccination program now, which is for both girls and boys nowadays in Australia. And it definitely works again, helps to well, protects, let's say, protects from cancer of the cervix, and we also think that it protects from cancers of anus, penis, vulva, vagina, and oropharynx, but there is no sufficient data to confirm this yet. So we think yes, but we're waiting for more data. So time is a factor here. We have various vaccines. I will not be going deeply into this. So there are prophylactic and therapeutic vaccines. So the vaccine, with this particular vaccine, acts that in a way that it assembles into viral-like particles, and they are highly immunogenic, and they look very similar to HPV, but they have no DNA, therefore they do not infect, and they produce quite a sensible antibody response. So in Australia, we have a female vaccination program, which started in 2006, and it's for girls aged 12 to 13. And since 2013, it's also for boys aged, again, 12 to 13. And there is quite a good response in Australia. So many children get vaccinated, hopefully producing much healthier population. How it works, as you can see on this picture, is that the blue, it's the normal epithelium. It looks innocent, but this virus needs a breach in epithelium. So that means a scratch or abrasion, and this is how it infects and attacks basal cell layer of epithelium. This basal cell layer is one of the layers of epithelium, and this is where it sits, and then it sort of stays there and stays, and more and longer, and it produces all the changes. So until on the far right, you have a graphic representation of the changes that can be observed in cancer. Natural history of HPV. So infection, well, as I mentioned, there has to be a breach in mucosa, skin, and this is how the virus enters the area. And then it takes weeks to months before it develops into a lesion. Usually, all the body clears the virus within 2 years. Usually, this is what usually happens. But sometimes the virus perseveres, and with time it turns into cancer. So that happens in about 10 to 20% of the recurrent disease, they say. But as I mentioned, usually there's not to scare you, but usually the virus gets removed by the body within 2 years. So this graph shows how long it takes for cancer to develop. It's even up to 20 years. Within one to 2 years, it usually gets cleared. But if the infection perseveres, it changes to high-grade lesions, which then transform into cancer.
Gosh.
Safer sex. Well, HPV is highly infectious. So if someone has a wart on their finger, for instance, and you shake hands and you have an abrasion, it's very likely that you would get infected. We're talking here about oral and digital transmission. And this is due to behaviors, very common now, apparently in high schools. Oral sex behaviors lead to early infection, and this virus can present, I'll talk about it later, it has bimodal representation. So it can occur at around 30 to 34 years of age, and then later in life around 60 to 70. So this is consistent with oral sexual activities in high school, and then if it turns to cancer, that's around 34 years of age presentation, and later on in life. Condoms are only partially protective because, like as I mentioned before, this virus is very small, so it can penetrate the pores in latex. So again, a similar picture showing that the mucosa or skin needs to be abraded or cut for the virus to penetrate. So if it's intact, it's impossible to get infected. It has to be abraded for the virus to locate itself in basal cell layer of epithelium. So when we talk about mouth, it could be even a minimal abrasion or microtrauma, like during toothbrushing. When you brush your teeth, you sometimes the gums get abraded sometimes. It's very easy and very often happens, let alone bleeding gums that many people have because of poor oral hygiene or calculus deposits. So well, perhaps this is one of the reasons why there is such a huge increase in prevalence of oropharyngeal cancer due to HPV.
Gosh.
So HPV infects oral and anogenital areas with variable oncogenicity. Sometimes, as I mentioned, it does not lead to cancer. It just stays for a while, and then the body clears it. So again, these are cancers, but HPV also causes absolutely benign conditions. So in various oral mucosal conditions in both oral cavity and genital areas. So we have examples here. So for papillomatous lesions are like warts, as you can see, ordinary warts. They can get transmitted to the mouth because people tend to chew or bite or chew on warts, and this is how the mouth gets infected, especially if there are cuts and abrasions there. So proper toothbrushing is the answer. This is another example of, again, HPV, but different subtype, oral condylomata acuminata, looking like cauliflower growths, which can present on gums, lips, palate, tongue, anywhere in the mouth, really. Verruca vulgaris, again, a similar representation, a little bit perhaps different presentation in the size, perhaps more singular lesions, but again and again cauliflower look, and again another representation of HPV infection or lesion in the mouth. And this is especially florid representation of HPV. Yeah, but this patient is HIV positive. And I mentioned again that HIV positive patients are more prone to viral infections. And then this is an example of how much more prone they are to viral infections, because they papillomatous lesions, and there is a really, well, especially florid example of growths. Another condition that's associated with HPV is called recurrent respiratory papillomatosis. And subtypes responsible for these conditions are 6 and 11, again, benign, not cancer causing. It is a rare condition where the cauliflower-like growths appear in upper airways. They can even cause airway obstruction or voice change. So a harsh voice is a sign of something going on. a prolonged, not your cold-associated harsh voice. Recurrent respiratory papillomatosis displays again bimodal age presentation. It can occur in children under 5 years of age. We're talking about juvenile onset of RRP then, and adult onset in people in over 40. Presenting symptoms, as I mentioned, include change of voice, harshness of voice, cough, and in severe cases, upper airway obstruction. And this is how it looks. This is the growth. The arrow is pointing to the growth. Again, cauliflower looking like growth. This is typical of HPV. And unfortunately, cancer, oropharyngeal carcinoma, which luckily presents here on the arch, which can be visible by the dentist. So I said visible by the dentist because this is one of the reasons why we're doing this research, because dentists are very often the only healthcare specialists that can spot cancer, and also people sometimes don't see doctors because they have no need to see doctors, but they go to dentists, especially young people, because they want to have white teeth or bleached teeth or whatever, clean teeth, and therefore dentist may be the only healthcare professional that may spot a cancer. This is why we're working towards increasing awareness amongst dentists and population as well, of course. So again, types 16 and 18 are associated with, well, a lot of oropharyngeal carcinomas, but there are other subtypes, as I mentioned in the beginning, and there is a lot of them, and surely we will find out there are more involved as well. We're talking about 640,000 new cases each year worldwide of head and neck cancer, which is a lot, and it's the 6th most common cancer worldwide. So it's quite a lot of this, unfortunately. So it is thought that the pathogenesis of HPV-related oropharyngeal squamous cell carcinoma, it's called properly, is similar to the one of cancer of the cervix. So we're talking about persisting HPV infection in tissues of the oropharynx, so it's tonsils again, the wall, uvula, base of the tongue, and if the infection persists, it results in high-grade squamous intraepithelial lesions. And over time, unknown proportion of those lesions are thought to progress to cancer. There is, because there's still early days, so we're still looking, our science is still looking at the situation. However, there is growing evidence which points to the similarities and differences in the prevalence and incidence and clearance of the virus between oral cavity and the cervix. Similarities, of course, mode of transmission, which is sexual behavior, and differences. There is a variation of prevalence patterns with cancer of the cervix or infection of the cervix with HPV, which is much higher than the infection of oropharynx, and it's age specific in terms that HPV of oropharynx is more associated more with older people, and the prevalence of HPV in the cervix decreases with age, so it's more with younger people. So there is a table. This is a table from a conference, Eurogene conference, which is a European organization that is devoted to HPV. And so again, there is a strong, both cancers of the cervix and oropharyngeal are strongly connected to sexual behavior and the bimodal presentation, whereas with cancer of the cervix, we are talking about younger population of girls, and then it decreases with age, whereas oral HPV infection and cancers are associated. Well, there is a bimodal presentation, as I mentioned, around 30 and 4 to 34 years of age and 60 to 64 years of age. So yeah, so they are the main differences between the age distribution between the two cancers. So again, there is growing evidence of close correlation between sexual behavior and oral prevalence of HPV. The prevalence of oral HPV is related to number of lifetime sexual partners, because the more partners, of course, the more possibilities of contracting the virus or getting infected with the virus. And also, the HPV oral infection is more likely in people who report first oral sexual experience at 18 years of age or younger. So the age of sexual initiation is also important. We set out to conduct a study in Australian population. It was a second study in Australia, general population. The other study that was conducted in Australia was among students in Adelaide or Melbourne, I think. So we correlated the detection of oral HPV DNA with oral sexual practices, demographics, and oral hygiene, which is another factor in potentially HPV infections. So our study's population came from New South Wales, Sydney, but really New South Wales as far as Newcastle and Blue Mountains. So we know that the HPV subtypes 16 and 18 are the known carcinogens in cancer of the cervix. And again, so there is an increased evidence that the same happens with oropharyngeal cancer. So the study was conducted in private dental surgeries in Sydney. We collected gargle and rinse for 30 seconds. Then oral hygiene index was also documented. That means we were checking how well people are brushing their teeth. And participants had to fill questionnaire, which had various questions regarding demographics and vaccination, but also sexual practices. Then the laboratory extracted DNA, and through PCR testing, they were testing for main subtypes, the ones that are listed here. So this is the oral hygiene index. A score was given, 0 being a very clean tooth and 3 being a grotty tooth. So this was documented as well under the questionnaire. So we had 168 females, 131 males. The mean age was well, almost 48 and a half years of age. Very good oral hygiene noted in general. 233 participants out of 300 had a very good oral hygiene, and well, not so good. 515 is not so good, but 5 was a really not a very good oral hygiene in 5 participants. So we detected HPV, but the high risk, which means cancer causing, that's what we paid most attention to, in 6 participants, which is 2%, which is consistent with the other study that was conducted in Australia, which is consistent also. Remember in the beginning, I said that in America, they found 3.7%, a little bit less here, but again, roughly about the same. So, so we had 6 participants who had high risk HPV subtypes, and 1 of the participants had 2 together. So this is again the results of the study, with 1 participant that had 2 subtypes of HPV, high risk HPV. Characteristics of participants who were found to have HPV in their salivary rinse was they were males only, 0 females, mean age 60, and well educated. 4 of them had university education and 1 postgraduate. They were 2 were currently smoking. No history of sexually transmitted infections, and none had HIV infection. 1 had history of warts, which is ordinary benign HPV infection, and none were vaccinated. So this was first sampling from the general Australian population. The recruitment was easy because they were regular patients of those surgeries. Patients were very, very friendly and understanding. They were forthcoming with risk history, even with sexual behaviors, because it sometimes can be well, not everyone likes to discuss this. These are very private matters. So combined with oral hygiene assessment, which was easy because it was conducted by the dentist, and the sampling technique was simple because with the sample, you can't say, oh, you can't go to your GP tomorrow and say, oh, I had this dentist and she scared me. I want to check if I have HPV infection. We can't because there are no tests available. So this is what we also looking at in long term, perhaps suggestion of the method of sampling. At the moment, the best one is gargle, like what we did, and we based our methodology of sampling on the American studies. So it's gargle and rinse. There are other suggestions that perhaps we could get more material if we pre-brush the mucosa inside, but we stopped at gargle and rinse. But it was still easy and well accepted by patients. That was a 30 seconds rinse with saline. Patients were wonderful, really. I was nervous when I was starting to study because I wasn't sure how my patients will react to me explaining the study. It was a questionnaire, so they could enter the answers themselves, of course. But I had to explain, and I had to touch on sexual health and oral sex. So there were funny moments associated with it. I will share one with you because I thought it was especially funny. I asked this patient if he would like to participate in the study, and I said this is about oropharyngeal cancer and about HPV infection in the mouth, and it's connected to oral sex. And there are questions about oral sexual procedures if he in a questionnaire, but if he agrees, and he says yes, no problem, and he says, do you mean with my wife or with other women too? Well, I said, well, so it was one of the funniest moments, but yes.
Oh dear, oh dear.
So yes, there were limitations, of course, to the study. It was a family practice. Majority of population was from Central Eastern European origin. And participants pointed it out to me that sexual practices were not specified clearly. Are you talking about receiving or giving? Yes, they were not specified because we were very gentle about the questions. We didn't want to go into details, but as it turns out, we should. Potential recall bias in terms that perhaps this did not happen, but it could potentially happen that the same patient could answer twice, potentially. And it was a point prevalence data only, which means that the study was approved as point prevalence. That means it was fully coded. And so participants that were found to have high-risk HPV could not be contacted to check in 2 years if the body has cleared the virus, because it was all coded, it was all anonymous. So we could not have follow-up appointments for those patients. This was approved this way because majority of cases, the body clears the virus within 2 years. So that's why it was approved. So there was no follow-up possible. But in summary, well, it was mission accomplished because the assessment was well tolerated. It was straightforward. We found HPV in a small minority, 2%, but it's 6 people out of 300. So depending how you look at it, they were all males. And from this, we think, how might this influence dental clinical practice? How can we prepare dental surgeries to provide screening for patients? Challenges in talking about sexual health. We dentists were not trained to talk about sexual health to patients, and many patients don't expect a dentist to touch on sexual health. So perhaps this is something that we should look at. Perhaps there should be more education in this area. And because, as I mentioned, we're looking at potential future role of dentists in screening and early diagnosis, therefore, because dentists are health providers. Future studies, we were going to look at Australian Aboriginal population because Australian Aboriginal population, women have very high prevalence of cancer of cervix and HPV in the cervix found. So we started this study, but could not continue because of COVID. May go back to it. We will see what future brings. And another future study that I'm finishing now is well, looking at the knowledge and acceptance of dentists, knowledge of HPV infection and oropharyngeal cancer, and acceptance of talking about this to patients and talking about sexual health, relevant sexual health issues to patients. And the other study is from the other side, from patients. What patients think, how do they think it's appropriate that dentist talks about this, and do they think that it's a good idea to have it checked, to have their throat checked while they're at the dentist for potential oropharyngeal cancer. So these are the 2 studies that I'm finishing now, hopefully, and but we've collected the data and it's just writing. That's all. So these are the studies that are happening actually now. So so yes. Because at the end of the day, dentists are healthcare providers. So this is a message to take home. Thank you very much.
That's been amazing. Thank you very much, Beata. Could I ask you please to stop the recording now, if that's okay?
Absolutely.
And if you could please just send me a copy of that when it gets sent to you.
Okay.
Because you'll receive a copy, and if you could